My name is Emmanuel Kamplegi, and then I'm a biomedical scientist. I manage the lab, attend to patients, and then check their laboratory investigations like malaria, the typhoid, and some other investigation.
The lab is like basically an extension of your arms, confirm, rule out. Like they have to, especially in an area where a lot of people come with fevers. You wouldn't know whether they are suffering from the common malaria, they are suffering from enteric fever. The lab has to help you differentiate.
The reason why I like working here is the patients. And some of the parents too, they give you a lot of respect because you work here and then you attend to their case, and then to them as well. They give you a lot of respect. So it makes the work so interesting.
My child is not well, that's why I'm here.
Here in particular, if I come, I get the nice care. They take care of my kids very well. They understand me. The lab tests always come out good, and if they give you the treatment, I think it works. So that's why I like coming here.
The whole thing is being fine. She actually attends here because she wants good treatment. That's why she's here.
They are always focused and they are always serious in their work. And they take time to take care of you. And the doctors too are doing well.
First of all, when they come, we take their insurance card
and the laboratory form, which doctor has taken, indicate what we should do for the patient. So because one person, 1 million. Sorry, Then I ask my patients to kindly wait outside for the results. So they really do not for results, but we are.
So after taking the sample, we prepare the test and then we take it inside. This patient is called Solomon. So Solomon, doctor said we should run malaria, typhoid, and then full blood count. So we mix for 5 minutes and then we come to the machine. We check, first of all, we check the patient's log number. The log number is 3236. So we enter it here, 3236, and then we press enter. And then we shake it again 3 or 4 times, and then we press our start button to run the test. Because it's automated, to run the test and then produce the results. So what we just do is to print it out. Solomon, his age is 10 years, and then we want to check his blood parameters. So we have the WBC, which is the white blood cells, is 6.2, the red blood cells is 4, and then the hemoglobin is 10.9. So we can see that the parameters are okay. So we press the alt delete to print the results out. This is the full blood count of Solomon. After printing, we staple it on the results. We give it back to Solomon. Solomon will present this to the doctor. So the doctor will check the parameters of the various full counts. If it's high, doctor will know that, or the physicians will have an idea that, oh, there's an infection. So the doctor will go ahead and prescribe some medication for the patient. Or if the hemoglobin is low, the doctor will say, oh, the patient have anemia, it's anemic, and then some medication will be recommended, or if there's a need for blood transfusion, it will be recommended. Malaria always comes with anemia. What the parasite do is they destroy your red blood cells so that your blood level will be low. So it always comes with anemia. So the doctors will request for malaria and anemia. And malaria, mostly averagely, we have about 1,200 cases every month, and then the positive cases are 800 plus. Yeah, that we report every month.
When the weather changes from the heat season to the rain, we have so much respiratory infections, so much infections in children. I think for every hospital, it's very important to have equipment, lab equipment, for example, and it has to be up to date. You know, it gives you a full picture to make a diagnosis. Having just 3 variables is frustrating because sometimes you don't even need those variables, you need other variables, and then it just doesn't cut it.
So this machine is very crucial to our work, and sometimes we have a lot of cases coming from outside to use this machine. We thank Chameleon Group a lot, and then I'm giving a thumbs up to them, especially Brian and then Steven. Brian in the United States and then Steven in the UK. I learned you guys are part of the brain behind this machine. Afrikids thanks you a lot, Bogatanga thanks you a lot, and Ghana as a whole thanks you a lot. So we owe you much appreciation. And Emmanuel, I salute you and I give you a high five for your help. This is our